Welcome back. 3 provinces are showing signs of a third wave of coronavirus infections. And as we head into winter, even more worrying is the slow pace of inoculations. Phase 2 of the country's vaccination drive kicked off yesterday with several challenges, but the health minister reckons it is being resolved. Let's speak to Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee. Prof, thanks so much for speaking to us. So, of course, we are hearing concerns from 3 other provinces that we are on the verge of a third wave. We know Gauteng declared last week that the third wave is here. Is there any way or anything we can do to make sure it's not as hectic as the second wave we endured?
Yes, a good day. Actually, good afternoon, Shahan, and thank you for having me on your show. Yes, actually, we really just need to be very much on the alert, as we know that if, for instance, we're looking at Free State now, we really think it actually entered into the third wave around mid-April. And Gauteng is truly on the verge as well. What then becomes important is that obviously when we're looking at a third wave, or any wave for that matter, there are a few criteria that we look at. Firstly, we want to look at the positivity testing rates. How high are we getting positives each day? And we get worried once we're getting close to 10% of positivity rates. And right now, if we're looking at nationally, we're sitting at around 8.4%, which is very close. And if you were to divide that into provinces, you will see that there are provinces that have actually reached that 10% threshold. The other critical area that we look at is the number of cases that we are recording. And we always look at this 7-day average numbers. And when we're looking really at new cases, right now, if you look at where we're sitting a week ago compared to this week, data that came through this morning shows that last week, which was week 18, we had 12,792 new cases, compared to where we are now at 15,708. Now, this is actually a 22.8% increase in new cases, which is quite worrisome. So what then becomes important is that as we identify these new cases, it's going to be important to make sure that we've got a very rapid response, because what really is going to delay the full course of any wave is how we manage the numbers as they begin to climb. So the message is going to be each and every province has got to be very, on the alert now at this moment. And where we're seeing infections, what becomes critical is contact tracing and testing, because remember, the more we actually identify any contacts of positives, and we test those and quickly isolate those who need to be isolated and quarantine those who need to be quarantined, that's the only way we are going to actually manage and control the waves. Yeah. And to the general public, it becomes important to ensure that we continue on the prevention interventions, masking properly, social distancing, avoiding crowds. So really, it still has got to be those messages that we must emphasize.
Yeah, so the basics are very important. Will the Ministerial Advisory Committee be advising government to enforce tighter lockdown restrictions?
Obviously, there's engagement that needs to go on. So what we have tried to do is to say, now that we've had 2 waves that we can learn from, what are some of the triggers that we could use for government to warn government to say you are likely getting onto the next wave, and then what are some of the things that must be done? And so really we have actually submitted an advisory that's looking at those things. And for us, this close monitoring being key number 1, and the second bit, because now we have got the data that has been generated over the months, and so we really can get up to like almost 2 weeks predictions and say, now this is going to happen. And so we are saying to government, be on the alert, and as these, criteria, as these come in and we get to know, there must be a very clear plan as to what we do, who does what when. And obviously, if then we see that, there's not the rapid response is not as rapid as it needs to be, then government would have to look at, do we then initiate certain restrictions, obviously depending on how each province, if we're looking at provincial interventions, how each province responds.
Yeah, so would you advise that provincial interventions come into play here? Because we're seeing some provinces obviously more affected with these third wave of infections than others.
Yes, definitely. I mean, the advantage that we have is whilst we have got national data, we're able to actually break down that data at, to provincial level. And even though we can break it further to district level, we just feel it really would be a bit too hectic to go at district level because people move in between districts, very easily. But definitely at provincial level, we can look at imposing restrictions depending, because I mean, right now we've got the two, provinces that are way ahead. Whereas if you look at the Eastern Cape and other provinces, they are still far off. They are probably about a month or two behind. And so really it will be important to ensure that if there are any restrictions that need to be, emphasized, then those go to the current provinces that are facing the wave.
Yeah. So what's the Ministerial Advisory Committee's advice to government when it comes to travel restrictions being implemented in South Africa? Because, of course, you know that we have seen the variants first discovered in India and the UK in South Africa.
Okay, insofar as the variants of concern, which is what we're calling them now, variants of concern are concerned, is that now we are aware that within the country, we actually have got 3 of the 4 globally defined variants of concern. One being the one that was first identified in this country, B1351. The second one being the one that was first described in the UK, B117. And the third one being the one that was first described in India, the B1617. So we have all these 3 in the country. They have been identified, isolated in the country. What's important as well is that if we're looking at these variants of concern, the 4th one is the one that was first identified in Brazil, which is P1. If you're looking at all these 4, they now actually occur in more than 40 countries, each of those. I mean, the one that was initially discovered in the UK is in more than 150 countries already, which therefore means we will get these variants and they have already spread to various countries. When we're then looking at restrictions into South Africa, what is critical is that everybody who comes into the country, the best way for us to protect ourselves is to make sure that there are strict guides at the airports or any other ports of entry, so that anyone who comes in, yes, they must come with a PCR that is negative for the, within the past 72 hours. But it's going to be important for us to do testing on our own, just to confirm that, so that everyone who comes in, especially from countries that have got high, positivity rates, high infection rates, that is. So they must be tested, and the easiest test to use would be the antigen test, because then you can pick up the positives and negatives rapidly. And anybody who is positive obviously needs to be isolated. And really what would even go further is if we were to even quarantine those that are negative until we can test them 5 to 7 days later, because then it ensures that if they are negative at 5 to 7 days, we have got all the more confidence that they are not coming in infected. And really from where we're sitting, we really think that will be the best, because it is not closing completely. And at the same time, there are enough measures that are being taken to ensure that no new variants or no new infections are coming into the country.
But, Prof, that hasn't worked, right? Because we have seen the variant first discovered in India make its way to South Africa, despite our measures in place at the airport when it comes to international arrivals. Why not a travel ban? Why are we so shy to impose bans like other countries have imposed on South Africa?
The difficulty in imposing a travel ban, you're going to impose a travel ban to which country? Because, like I say, if, for instance, you're looking at the variant that was first identified in India, it's already seen now in more than 40 countries. So then,
but the majority of the infections are in India, right? So the obvious answer would be India.
Well, but what about you? We don't know how high those rates that are actually in other countries, how quick it's going to take for these variants to be in those countries. And so rather than creating a false sense of security and say, we're just going to ban India, we're going to ban Brazil maybe, we're going to ban the UK. But I mean, the one from the UK is already in 160 countries. And so really, is that going to be fair on those countries? What we just need to do as a country is to make sure that our measures at the ports of entry are strict. And everybody who's coming from those countries, they must know that they are going to be quarantined before they can move into the country until there's assurance that they are not infected.
You see, I get your point, and I understand why you're saying that, but the reality is that if we see a more infectious variant of this virus enter our country, our third wave is going to be worse off than the second wave. And we are not at a point where we're vaccinating a large part of the population daily. In fact, we're struggling to get tens of thousands of people vaccinated daily.
Oh yes, no. I fully agree with you that actually it's important for us to get the vaccination program as quickly off the ground as possible. And we really are experiencing delays, which we do not want. But, you know, the issue about the severity of these variants is that actually we are hosting as a country one of the most severe variants in the first place. And so to then say we obviously we don't want more variants, but I mean, you know, if you already have got a variant that is of serious concern already within the country, I'm not appreciating that it's going to make much of a difference if you then say the one from the UK must also, you know, there must be a ban on anybody who's coming from a country that has got that variant. Because actually the current variant in the country is one that has got the worst outcomes compared to the variants of concerns that we have.
But that's what other countries did to South Africa when we discovered that variant here. They took precaution and they didn't let us into their countries. In fact, they're still not letting us into their countries, and they've inoculated millions of people.
Yes, and there's a fair reason for that, because we have got one of the worst variants. And so that's probably why they're not allowing us into their countries. So, but I mean, at the same time, really, you know, all said and done, this is when we're looking at the available data. And this is what we are proposing. And as you know, it's an advice, whether to be taken or not to be taken. But really, when we're looking at data, we really are not convinced that there is enough data to say we could pinpoint specific countries. Rather, what we are doing is to say, rather look at countries that have got high, you know, infectivity rates.
Yeah.
Now, that's going to cut across a lot of countries, and that is the advisory we have said, rather than saying India specifically. But let's rather look at what are some of the other criteria that must be worrying us as a country. So if there are countries that have got high infectivity rates, high transmission rates, and then when they come, we need to be strict on them and want to make sure. So at the end of the day, it's going to go back to whether our ports of entry can really adhere to those strict measurements. And otherwise, if not, we can ban those countries, but then we will get people from other countries where these variants exist, and we will still have those variants coming into the country.
Yeah. All right, I get you. Thank you so much for your time and your insight. Yeah. I appreciate it.
All right.
That, of course, is Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee.